You're watching WMBC TV, Newton, New Jersey.
And do you know the different symptoms of what having a heart attack may feel like between women and men? Tonight, Kimberly Wallace explains how awareness has decreased heart disease-related deaths in recent years, and what you can do to be proactive.
Who knew those red clothes in your closet could help spread awareness about heart health? Heart disease is the #1 killer among women, and today, National Wear Red Day is a nationwide movement to urge women to take action, learn the risks of heart disease, and get annual checkups.
If you're monitoring it yearly or every 6 months, the doctor gets to stay ahead of it before it becomes a problem. If you unfortunately see your doctor when you're not feeling well, then the doctor's playing catch-up. Whereas if you see him regularly, once a year, he's checking your blood pressure, your cholesterol, and your weight, he can then advise you, okay, we have to do this. You might have to take some statin medications to control your high cholesterol.
According to the Heart Truth, progress has been made in increasing awareness among women from 34% in 2000 to 57% in 2006. Medina says it is that increased awareness that has contributed to 17,000 fewer heart disease-related deaths annually in women in recent years.
They've seen a reduction in coronary heart disease for women, and that's basically because we're getting the word out. And women are taking more care of themselves, and they're realizing that heart disease is not a disease just for men.
According to Women in Health statistics, Americans can reduce their risk of heart disease by as much as 82% by simply living a healthy lifestyle, such as cigarette smoking cessation, physical activity for 30 minutes on a regular basis, weight management, among others.
You got to watch your cholesterol. You got to increase your fruits and vegetable intake. Cholesterol is another factor, is another risk factor for heart disease. It narrows your arteries and puts you at risk for occlusion. If you stay active, you're pumping your heart and you're keeping your heart in good health.
Nationwide, organizations and hospitals hosted health fairs where women and men were offered free health screenings and information on heart disease. Medina says it is essential for people to know the symptoms of a heart attack, which includes fatigue, pain, and squeezing sensations, all of which can differ in men and women.
The symptoms for a heart attack is obviously pain in your chest, in the center of your chest. Some of the classic ones is when you get the pain in your chest, it runs down the left side of your arm. For some women, it tends to run up to the shoulders and maybe the jaws, and they'll have some indigestion. So they might say, oh, it's nothing. Don't. It's better for you to come to the hospital, have a trained emergency room doctor examine you.
Sheila Brown had her blood pressure taken today, where nurses told her it was alarmingly high.
It was a little higher than it normally is, and I'm going to call my doctor as soon as I get back to my office.
Every Friday throughout the month of February, Raritan Bay Medical Center will be holding similar screenings at both of its campuses. Reporting from Perth Amboy, I'm Kimberly Wallace, WMBC News.